I've started your timer and here is your question.
Okay, ma'am.
Yes, sorry, what's happened? Yes, here is your question. Right, so if you have read and understood considering the critical care scenario, please tell me how would you manage this patient now?
Okay, looking at the scenario, the patient has pulmonary edema. I want to manage in the ABC of risk protocol. Following the ABC of risk protocol, I want to restrict fluid therapy for this patient. I want to give high flow oxygen at 10 liters per minute via non-revital face mask. I want to set whiteboard kanalen, take samples for investigations, and I want to give reduce the preload, reduce the afterload, and to improve the cardiac contractility. To reduce the preload, I want to give diuretics and also give glyceride,
You'll
nitroprusside.
stop. Yes, I'm sorry to interrupt you. Before you'll give anything, you'll stop any IV fluids and any IV. So you'll stop first, then you'll think of giving. Yes. Continue, please.
Yes, my sir, I will discontinue fluid therapy.
All right,
Yes,
sorry, I thought you said you'll continue. Okay, continue.
Yes,
please.
sir. So I'll give GTN, give diuretics, give morphine.
Yes.
To reduce afterload, I want to give enalapril or captopril, or to give
how much
angiotensin receptor blocker.
Captopril would you give, please?
25 milligram IV.
25 milligram. Okay, can you please tell me what kind of ventilator support would you consider for this patient?
Sorry, come again?
What type of ventilator support would you consider for this patient?
Yes, I want to call it PEEP, positive end specific pressure. PEEP.
Which one?
PEEP.
CPAP. CPAP.
Okay, CPAP.
Yes.
CPAP,
yes.
CPAP
right.
to prevent.
You can tell me later what CPAP is, but what inotropic support would you suggest in this situation?
I want to give dobutamine and
yes,
dopamine.
Why? Yes, why?
Ma'am?
Yes, why would you suggest dobutamine?
Dobutamine acts better on the heart. While dopamine will help with to increase the blood flow to the kidney.
Yes, and it stimulates which receptors? You have to know, beta receptors. That's why it will increase.
Beta receptor.
Yes, it will increase the circulation. All right. Can you please tell me, patient was given 7 liters of IV fluids, in which 4 liter normal saline. Comment kindly on the amount of fluid which was given onto the patient.
That's fluid overload. Usually patients should not have more than 2 liters of IV fluid in 24 hours, and this patient had 7 liters.
How should you decide what amount of fluid should be given to a patient post-operatively?
The patient, the daily maintenance and ongoing loss.
Yes. Should be.
We had the daily maintenance together with the ongoing loss to decide what to give him the next day. All
right. In this situation, which type of fluid should be given or should be ideally given?
It should be crystalloid.
Yes, why?
Crystalloid state is I'll come back to that now.
Okay. In this patient, what are the indicators that you'll follow up in order to realize that patient is now out of this pulmonary edema?
Yes,
or
ma'am.
out of the fear?
The follow parameters include the pulse, the
Okay.
temperature,
Yes.
the blood pressure,
Yes.
the respiratory rate, the
Yes.
urine output,
Yes.
central venous
What
pressure.
should be the minimal amount of urinary output that you expect?
0.5 mils per kg per hour.
Okay. Yes. Can you please also tell me what are the conditions that can result into low urinary output?
Other condition that can lead to low urine output.
Yes, please.
If there is the patient that is in shock.
Okay, post-operative patient, acute injury, yes, acute renal injury, and
yes, shock. Then
yes.
Sepsis, polytrauma.
Okay. Can you please tell me where would you manage this patient?
This patient is a critical people in the intensive therapy unit.
High dependency unit. Okay. Can you please tell me what measures would you take to prevent this happening again?
I want to fill incident reports.
Okay. Then?
Yes, then I want to training and retraining of the junior staffs.
All right. What more?
And also to monitor patients' vitals closely.
You'll also insert central
line.
CV line, yes. And you'll attach the patient to the monitor. You'll follow the, monitor all those things. And then you'll do the report as well. Okay. Yes. If you can tell me, please, how should, if you'll take the image of this patient, what images can you take and what do you expect to find on the image?
I can do chest X-ray.
Yes.
And this will show bat wing sign, Kelly B line, cardiomegaly, pleural effusion.
Yes. Okay. If you can help me read this, please. What you see?
Okay. This PA chest X-ray.
Yes.
Showing is cardiomegaly.
Yes.
There's a blunting of the left costophrenic and cardiophrenic angle.
Yes. And
there is alveolar edema.
Okay.
With interstitial edema.
Yes.
Then the upper lobe, the dilation of the upper lobe veins, upper lobe vessels.
Can you see curly B lines anywhere?
Curly B lines are down by the lower lobe.
So
I can't really appreciate one here now.
Okay, in this scenario, when the patient after post-operatively undergoes into shock, patient normally becomes oligouric. How do you think this patient should be managed at that time?
Yes, ma'am. Following post-operative patient that has oliguric, patient should be placed on maintenance fluid, however, not to overload the patient. Also, the patient should be given dopamine.
Okay.
To maintain the renal perfusion.
Yes, first and foremost, you'll check the urinary catheter if it's not blocked. Because this patient was also oligouric. So first of all, you'll check if the patient's catheter is not blocked. Once you've reassured yourself that it's not blocked, then you'll manage all this that you're telling me. Because first you have to see the first cause. All right, good. Thank you.
Thank you, ma'am.
Thank you.